Welcome to Deep Dive Dialogue on Shaping the Future of Gynecological Cancers Care, integrating genomic insight into precision oncology. Genomic insights are transforming the treatment of gynecologic cancers such as ovarian, cervical, and endometrial cancer by enabling personalized therapies. Identifying specific genetic mutations and biomarkers allows clinicians to tailor treatments, improving early detection, treatment response, and patient outcomes. Today we'll discuss about cervical cancer and how precision oncology is by advancing care in this area. We have with us Dr. Sarita Kumari to share her insights. Dr. Sarita is gynecological oncologist specializing in the treatment of cancers in women. She was trained at All India Institute of Medical Sciences and is skilled in both traditional and minimal invasive surgeries. Dr. Sarita is also a dedicated researcher and educator focused on improving the care and outcomes for women with cancer. So welcome, Dr. Sarita.
Thank you, Manisha, for your kind introduction, and I would like to thank your channel for allowing me an opportunity to speak over here.
Right. So I think, Dr. Sarita, we'll start from the basic first. So I'll ask you that what are the primary causes and risk factors for cervical cancer, and how does HPV infection contribute to its development?
Okay, thank you for your question. Well, if we look at cervical cancer, it is one of the cancers for which we know the pathway of its origin very properly. It is primarily caused by persistent infection with high-risk strains of human papilloma virus, and it is also a sexually transmitted infection. So, of the 200 HPV types, we have 13 or 14 high-risk types. And among them, if you look at HPV type 16 and 18, they contribute to more than 70% of cervical cancer cases. Others are 31, 33, 45, which are mostly covered in the vaccine also. So, naturally, in a woman, most of these infections clear out on their own due to immunity and several other factors. But in few patients, these infections persist for a longer time and then they give rise to cancer. Right. And if you ask about risk factors, then there are several risk factors which have been studied, and they have either a direct or indirect contribution to formation of cervical cancer. So one of them is multiple sexual partner, early onset of sexual activity, being immunocompromised, HIV/AIDS, or smoking, lack of any screening for cervical cancer, or even the socioeconomic status of the women. So basically everything revolves around acquisition of the HPV infection.
Right. And since HPV infection is very important, so it's very important to diagnose, to pick it up early. So how effective are the current cervical cancer screening methods such as pap smears and HPV testing in reducing disease incidence?
Okay, so we have two main cervical cancer screening methods, as you said, pap smear and HPV DNA tests. So both have been studied in a lot of trials, and they have shown to significantly reduce the cervical cancer incidence and mortality. So first we'll talk about pap smear test. So it is 50 to 80% sensitive. The sensitivity varies from lab to lab, and also the technique, how we are collecting the smear. And its specificity is 90 to 98%. And if we look at trials, then since its introduction, it has resulted in almost 70 to 90% reduction in incidence of cervical cancer and 70 to 80% reduction in mortality. Now, coming to HPV testing, HPV is little bit more sensitive, as it is almost 90 to 100% sensitive for high-risk types, and specificity is more or less same, 90 to 98%. And it also has shown a significant reduction of 90 to 95% in incidence and almost 90% in mortality. So all the guidelines, like American guidelines and WHO, they recommend, as of now, they have recommended HPV DNA testing as the primary screening test for eligible women. But although these are the tests, but they also have some limitations, like HPV testing has a very high false positive rate. So they lead to a lot of women getting unnecessary colposcopies and further treatment. But anyways, they reduce the mortality and incidence of cancer.
Right. So by integrating the HPV screening method and by vaccinating the population widely, I think we can, catch hold of the cervical cancer early.
Yes.
Correct. So my next question is that how is cervical cancer typically staged, and what factors determine the choice of treatment in each stage?
Okay, so we do staging to determine what are the treatment options available to the patient, and also to prognosticate. So we have two staging systems. One is the FIGO system, or the International Federation of Obstetrician and Gynecology. So this was revised in 2018, and it uses clinical imaging as well as pathological factors to assign a stage to a woman. And along with it, we also have the AJCC, or the American Joint Committee on Cancer. They use the tumor, lymph node, and metastasis status. So AJCC runs parallel to FIGO, and both are equally effective. But if you ask me the factors determining what treatment we choose for each stage, so it depends on a lot of factors like the age of the patient, the histology of the cancer, and the type and the grade of tumor. Also, the overall health status of the women, her desire for fertility preservation, and imaging wise, what is the size of tumor, location of tumor, whether pelvic nodes are involved or not, whether there are any metastases. So based on all these factors, we assign a stage to a patient, and if the patient falls into earlier stages like stage 1 and early stage 2, then surgery is a possible option. And there are various forms of surgery like simple hysterectomy, radical hysterectomy, or if the patient desires fertility preservation, we can offer trachelectomy or conization. A lot of data is coming. Now we are going more towards the conservative approaches. And whenever the patient stage is advanced or locally advanced, then we have an option of chemo radiation, which is the only possible option in such stages. And if the patient is presenting in a metastatic stage like 4B and all, then the treatment is done with a palliative intent, and we give chemotherapy to the patient and offer radiation if there is a response to chemotherapy. So in a nutshell, this is the treatment basically which we offer.
Right. So now moving on to precision oncology, since it's highly dependent on genomics. So how has genomic profiling influenced the use of targeted therapy or immunotherapy in cervical cancer care?
Okay, yes. So see, when we are doing genomic profiling in cervical cancer cases, we are able to identify some driver mutations. We are able to see and assess which biomarker would be useful in this patient, and we can offer a personalized treatment to our patient. So of the various targeted therapies which have been studied, the most important of them is angiogenesis inhibitor or bevacizumab, which is approved as first line in advanced or metastatic cervical cancer. Other than this, sometimes we also use tyrosine kinase inhibitors or PI3K, AKT/mTOR inhibitors or PARP inhibitors, depending on case to case. And if you talk about immunotherapy, then recently pembrolizumab has been approved as a first-line treatment option in advanced and metastatic cancer, and also in recurrent setting. And also, if you look at the vaccine, these are also a type of immunotherapy. Along with there are several therapies like adoptive T-cell therapy, which is emerging as a immune response against cancer cells. And also we test several biomarkers on our patients, like we test the expression of PD-L1 to see what would be the response of immune checkpoint inhibitor. Or we see the tumor mutational burden. Also we see microsatellite instability if we want to offer some patient immunotherapy in particular. So a lot of trials are going on related to these aspects, and which help us in deciding what therapy to offer in what patient, how to combine different modalities of treatment. So I would say that genomics is really coming up in cervical cancer.
Right. So every patient is different, especially in metastatic and advanced stages. It holds promise.
Yes.
So my next question would definitely be about your opinion, that how do you envision the role of precision oncology evolving the care of gynecological cancers, particularly cervical cancer, over the next decade?
Okay, so this is a very important question. So if I see the last 10 years, how newer and newer agents are being continuously coming into the cancer care. Every year we have like 15 major trials showing good PFS and OS benefits of a particular treatment options, and now we have come to a point where we are confused what to choose from. So I feel that precision oncology is going to have a significant impact in gynae cancer care. In short term, if you see, more and more patients would be getting genomic profiling of their tumor. Clinicians would be using targeted therapies to a greater extent, also immunotherapy. Now we will also be using liquid biopsy to see whether the cancer has recurred or to see the response of the tumor. And also we are seeing increased usage of artificial intelligence tools to make a diagnosis and treatment plan. And in long term, I see a lot of trials coming up revolving around these therapies. We are still awaiting CAR T-cell therapy in gynae cancers, or tailored neoadjuvant treatment options, or personalized therapy, if you say. Also epigenetics.
Right.
Like we have patients who have some particular genetic makeup, and we can offer treatment based on that. Now, specifically about cervical cancer, one most important thing which I see now is that more therapies would be able to target the human papilloma virus genome. So they will, because since HPV driven tumors are most common, they constitute more than 90% of cancers. So we have to develop agents which are active against these HPV mutated tumors. Also, if you see, like, which are still under development for cervical cancer, but 1 or 2 vaccines have crossed phase 2. So if you talk about, then we can call it immunoprevention or immunotherapy only. So I feel that there is a lot of scope for precision medicine in gynae cancers, and particularly in cervical cancer.
Right, fully agree. And I also believe that genomic medicine is transforming the way we treat cancer. And of course, it is entering into the gynecological cancers as well, and changing the landscape of cervical cancer. And early detection and personalized treatment is the way forward. Thank you, Dr. Sarita, for joining us.
Yeah, thank you, Manisha, for inviting me. Thank you so much.